2 new Zika cases confirmed, pushing the total in the country to 10. Good evening, everyone. I'm Keishla Adderley.
And I'm Charisma Robinson. Health officials stepping up efforts to prevent the spread of the Zika virus as the new cases were locally transmitted.
Now, during an interview with our Carla Palmer today, authorities called on members of the public to take all the necessary precautions to protect themselves from this disease.
Chief Medical Officer at the Ministry of Health, Dr. Glenn Benaby, confirmed the 2 new cases of the Zika virus. Having concluded a travel history, Senior Medical Officer in the Surveillance Unit at the Department of Public Health, Dr. Merciana Moxie, says the 2 females presenting are both residents here in New Providence and contracted the virus locally.
One is in the central area of New Providence and the other one is in the western area of New Providence.
As a result, Dr. Benaby says fogging efforts will intensify to reduce the breeding grounds for the insect that causes Zika, the Aedes aegypti mosquito. At the same time, he reiterates the message that residents must do their part to ensure their surroundings do not facilitate an environment for the mosquito.
We want to maximize the effort in the areas where we know that we have found cases. It doesn't mean that we will not include other areas because there's an itinerary of scheduling of cases. But when we find new cases, we will improve and increase the number of fogging in those areas. And we would very much love to see more community initiative and activities in helping to discard containers that contain water, as well as persons to cover up more in terms of long sleeve clothing, and the utilization of insect repellents.
Initially, there were 83 suspected cases being tested. 50 of those cases came back negative, leaving 33 results yet to come in.
The 2 additional cases that were confirmed yesterday are not a part of that. The 33 that we are waiting on now.
While there have been no confirmed cases of Zika involving pregnant women, consultant in maternal child health at the Ministry of Health, Dr. Percival McNeil, says it's important that all pregnant women be monitored,
regardless of what the test shows, because the duration of pregnancy is 9 months, and someone can become infected at any stage of pregnancy with very adverse results and outcomes. So, and the testing for pregnant women is a bit more complicated, meaning that the virus is detectable in the blood for up to 2 weeks. It may be detectable in the urine for a longer period, up to 2 months.
Health officials put the cost associated in fighting Zika in the millions of dollars.
It should be $2.5 to $3 million per annum. But having said that, the most important thing is that we must appreciate that the cost is bearable, is changing, and is likely to increase. As you can imagine, if one of these cases develop neurological symptoms, Guillain-Barré disease, and need to go on the intensive care, on ventilation, immediately that skews the result, and we have significant costs associated with that one case.
Health officials say they are doing everything they can to control the spread of the Zika virus and want members of the public to do the same. Carla Palmer, ZNS Network News.